Question 1. A patient is admitted for dehydration due to vomiting from chemotherapy for metastatic bone cancer. What is the correct sequencing for the primary diagnosis in this case? A. Dehydration. B. Metastatic bone cancer. C. Vomiting. D. Complication of chemotherapy. Answer: A. Dehydration. This question tests the concept of sequencing codes when a condition results from a complication of medical treatment. The key phrase "admitted for dehydration due to vomiting from chemotherapy" indicates that the reason for this hospital admission is the dehydration, which is a direct consequence of the chemotherapy's side effects, vomiting. In these situations, the complication code, dehydration, is sequenced first, followed by the code for the underlying condition, metastatic bone cancer, and then codes for the adverse effect of the therapy and the symptom, vomiting. A practical example is when someone with cancer receiving chemo gets severely dehydrated and needs hospitalization just for that. The dehydration is the main reason they are currently in the hospital. Remember to code the condition the patient is being treated for first, even if it's a side effect of treatment for something else. Question 2. A patient is seen in the outpatient clinic for routine follow-up of hypertension. They also have a history of a myocardial infarction, MI, 3 years ago, but it is stable with no current symptoms. Which of the following should be coded? A. Hypertension only. B. History of myocardial infarction only. C. Hypertension and history of myocardial infarction. D. Myocardial infarction. Answer: C. Hypertension and history of myocardial infarction. This question tests coding chronic conditions and past medical history in an outpatient setting. The clue here is routine follow-up of hypertension and that the patient also have a history of a myocardial infarction. Outpatient encounters require coding all documented conditions that coexist at the time of the encounter and require or affect patient care, treatment, or management. Even though the MI happened years ago and is stable, a history of MI is often relevant to overall patient care and is a chronic condition. Hypertension is an active chronic condition being managed. For example, a patient with both conditions needs careful consideration of medications and lifestyle advice. Remember to code all documented conditions that are relevant to the patient's care during that visit. Question 3. A patient presents with a sprained ankle. The physician notes it is the first time this ankle has been injured. What seventh character should be used for the ankle sprain code? A. B. D. C. S. D. P. Answer: A. This question is about using the correct seventh character for injuries. The key phrase is "first time this ankle has been injured," which means this is the initial encounter for this injury. The seventh character is used for the initial encounter for a closed fracture or an open fracture or any other injury, indicating the patient is receiving active treatment for the injury. Subsequent encounters for routine healing would use D, and sequela, late effects, would use S. Think of it as meaning active treatment begins now. For example, if a patient goes to the emergency room right after spraining their ankle, the character is appropriate. Question 4. A patient has both essential hypertension and chronic kidney disease, stage 3. What is the correct relationship assumed between these two conditions in ICD-10-CM? A. They are unrelated unless specifically documented as such. B. The hypertension is the cause of the chronic kidney disease. C. They are related unless the documentation clearly states otherwise. D. The chronic kidney disease is the cause of the hypertension. Answer, C. They are related unless the documentation clearly states otherwise. This question tests the assumed relationship between hypertension and chronic kidney disease, CKD, in ICD-10-CM. The rule is that hypertension and CKD are presumed to be related unless the provider explicitly states in the medical record that the conditions are unrelated. Therefore, combination codes exist that include both hypertension and CKD, reflecting this assumed link. For example, if a patient's chart lists both diagnoses without stating they are separate issues, you'd use a combination code linking them. Remember this specific guideline: hypertension and CKD are considered linked unless the doctor says they are not. Question 5. A patient is admitted with pneumonia. The physician documents lobar pneumonia due to Streptococcus pneumoniae. What is the correct principal diagnosis? A. Lobar pneumonia. B. Streptococcus pneumoniae. C. Lobar pneumonia due to Streptococcus pneumoniae. D. Pneumonia. Answer, C. Lobar pneumonia due to Streptococcus pneumoniae. This question focuses on coding pneumonia caused by an infectious organism. The phrase due to Streptococcus pneumoniae clearly links the specific type of pneumonia, lobar, to its cause. When a diagnosis includes both the condition and the causative organism, ICD-10-CM often provides combination codes that capture both pieces of information. Coding specifically lobar pneumonia due to Streptococcus pneumoniae is more precise and follows the guideline to code the definitive diagnosis with its known cause when available. For instance, if a patient is hospitalized specifically for pneumonia caused by a lab-confirmed strep infection, using the combination code tells the full story. Always look for combination codes when a condition is described with its cause. Question 6. A patient presents for a preoperative evaluation for elective gallbladder surgery. The patient has no complaints at this visit other than needing the clearance. What is the primary reason for this encounter? A. Gallbladder disease. B. Preoperative evaluation. C. Elective surgery. D. No abnormal findings. Answer, B. Preoperative evaluation. This question tests the coding of reasons for visits that are not directly for treating an illness or injury. The key phrase presents for a preoperative evaluation indicates the purpose of the visit. Even though the patient has gallbladder disease, the reason for this specific encounter is the evaluation needed before the surgery. ICD-10-CM provides specific Z codes for encounters for examinations or evaluations, such as preoperative evaluations. For example, if a patient sees their primary care doctor just to get cleared for an upcoming surgery, the pre-op evaluation Z code is the main code for that visit. Code the reason the patient is presenting for care today. Question 7. A patient has been diagnosed with malignant hypertension. What code category should you look for in the ICD-10-CM alphabetic index? A. Hypertension, benign. B. Hypertension, essential. C. Hypertension, malignant. D. Hypertension, secondary. Answer, C. Hypertension, malignant. This question is about using the ICD-10-CM alphabetic index correctly based on diagnostic terminology. The diagnosis provided is malignant hypertension. You should always start your coding search in the alphabetic index by locating the main term, which is hypertension, and then finding the modifying term that describes the specific type, which is malignant. The alphabetic index entry for hypertension, malignant will direct you to the correct code category. For instance, If the doctor writes, patient presents with malignant high blood pressure, you'd look up hypertension and then malignant to find the code. Always go to the alphabetic index first and follow its instructions. Question 8. A patient presents to the emergency department after a car accident as a pedestrian. The physician documents multiple traumatic injuries, including a fractured femur. What external cause code category is most appropriate for the car accident? A. V00V09 pedestrian injured in transport accident. B. V40V49 car occupant injured in transport accident. C. W00X59 other external causes of accidental injury. D. Y90Y99 supplementary factors associated with causes of morbidity and mortality. Answer A. V00V09 pedestrian injured in transport accident. This question is about selecting the correct external cause code based on the circumstances of the injury. The important details are car accident and as a pedestrian. External cause codes describe how the injury occurred, and the V codes are used for transport accidents. Since the patient was a pedestrian struck by a car, the appropriate category is for a pedestrian injured in transport accident. If the patient had been inside the car, a different V code category would be used. External cause codes provide valuable data about injury mechanisms, like knowing how many pedestrian vehicle accidents occur. Always identify the type of accident and the patient's role, example driver, passenger, pedestrian, to select the right external cause code. Question 9. A patient is diagnosed with stage 2 pressure ulcer of the sacrum. What is the minimum number of codes required to report this condition? A. 1. B. 2. C. 3. D. 4. Answer B. 2. This question tests coding pressure ulcers, which typically require more than one code. You need one code to identify the specific site of the pressure ulcer, sacrum in this case, and a separate code to identify the stage of the ulcer, stage 2. ICD-10-CM has combination codes for site and stage for some conditions, but for pressure ulcers, you generally need a code from category L89 to specify the site and stage together. Therefore, you need at least one code that captures both the site and stage. For example, L89.112 would be the code for stage 2 pressure ulcer of the sacrum. Always check the tabular list and guidelines for conditions like pressure ulcers, as they often require codes for both location and severity. Question 10. A patient is admitted with an acute exacerbation of chronic obstructive pulmonary disease, COPD. What is the correct way to code this condition? A. Chronic obstructive pulmonary disease. B. Acute exacerbation of chronic obstructive pulmonary disease. C. Acute bronchitis. D. Chronic bronchitis. Answer B. Acute exacerbation of chronic obstructive pulmonary disease. This question asks about coding COPD with an acute exacerbation. The phrase acute exacerbation of chronic obstructive pulmonary disease is a specific diagnostic term that has a dedicated code in ICD-10-CM. An exacerbation means a worsening of a chronic condition. When documentation states both the chronic condition and the acute exacerbation, you should use the single code that captures both aspects. For example, if a patient with long-standing COPD suddenly has severe breathing difficulty requiring hospitalization, the diagnosis of acute exacerbation of COPD is used and coded with a single code. Always look for combination codes that describe a chronic condition with an acute worsening. Question 11. A patient is seen for follow-up after completing treatment for breast cancer 6 months ago. There is no evidence of current disease. What status code is appropriate? A. Personal history of malignant neoplasm of breast. B. Malignant neoplasm of breast, primary. C. History of therapy for malignant neoplasm. D. Encounter for follow-up examination after completed treatment for malignant neoplasm. Answer: A. Personal history of malignant neoplasm of breast. This question deals with coding for a patient who has completed treatment for cancer and is now disease-free. The clue is after completing treatment and no evidence of current disease. In ICD-10-CM, when a malignancy is no longer present and the patient is receiving no treatment, a personal history code is used to indicate that the patient previously had that condition. Encounter codes for follow-up examinations, Z codes, might also be used, but the personal history code specifically captures the fact that they had cancer in the past. For instance, if a patient had breast cancer removed and finished chemotherapy, and now just comes for checkups, the personal history code is vital for their medical record. Use personal history codes for conditions that are no longer active but are relevant to the patient's past medical history. Question 12. A patient presents with type 2 diabetes mellitus with diabetic nephropathy. What is the correct coding approach? A. Code type 2 diabetes only. B. Code diabetic nephropathy only. C. Code type 2 diabetes and diabetic nephropathy separately. D. Use a combination code for type 2 diabetes with diabetic nephropathy. Answer: D. Use a combination code for type 2 diabetes with diabetic nephropathy. This question tests the use of combination codes for diabetes and its associated complications. When diabetes is documented with a complication, such as nephropathy, kidney disease, a combination code that includes both the type of diabetes and the specific complication is generally available and should be used. ICD-10-CM guidelines specify that codes for diabetes mellitus with complications are combination codes. For example, if a patient with type 2 diabetes is found to have kidney damage caused by the diabetes, a single code exists that reflects both conditions. Always look for combination codes when diabetes is linked to a complication. Question 13. A patient is diagnosed with acute bronchitis. Which of the following is the correct main term to look up in the ICD-10-CM alphabetic index? A. Acute. B. Bronchitis. C. Chronic. D. Respiratory. Answer: B. Bronchitis. This question is about finding the main term in the alphabetic index for a diagnosis. The diagnosis is acute bronchitis. The main term is the condition itself, which is bronchitis. Acute is a modifying term that describes the type or duration of the bronchitis. You would look up bronchitis in the alphabetic index first, and then find the subterm acute under it. For instance, if the doctor writes patient has sudden onset cough and chest congestion, diagnosed as acute bronchitis, you would start by finding bronchitis in the index. Always start with the condition as the main term when searching the alphabetic index. Question 14. A patient has an infected open wound of the left forearm. The infection is due to Staphylococcus aureus. How many codes are needed to accurately report this? A. 1. B. 2. C. 3. D. 4. Answer: C. 3. This question requires coding an infected wound with the causative organism. You need a code for the open wound of the forearm, which includes the site and laterality, left. Since it is infected, this requires an additional code for the infection itself. Furthermore, the specific organism causing the infection, Staphylococcus aureus, also needs to be coded. So, you would need a code for the open wound of the left forearm, a code indicating it is infected, and a code for the Staphylococcus aureus infection. For example, S51.812A, open wound forearm, left, initial, T89.04L, infected open wound of forearm, and B95.61, Staphylococcus aureus as the cause of diseases classified elsewhere. Therefore, at least 3 codes are required. Question 15. A patient is seen for a routine physical examination. During the exam, the physician identifies and treats a minor rash on the patient's arm. What is the correct sequencing of codes? A. Code for the rash followed by the code for the routine physical. B. Code for the routine physical only. C. Code for the routine physical followed by the code for the rash. D. Code for the rash only. Answer, C. Code for the routine physical followed by the code for the rash. This question tests sequencing codes when a routine exam occurs and a problem is also addressed during the same visit. When a routine general medical examination, like an annual physical, is performed, and a significant abnormality is found and treated or a new problem is evaluated during the same encounter, the code for the routine examination, AZ code, is sequenced as the primary diagnosis. The codes for the abnormal finding or new problem are then listed as secondary diagnoses. For instance, if you go for your yearly checkup, and the doctor also treats your poison ivy, the code for the physical is primary, and the code for poison ivy is secondary. Always code the reason for the visit first, even if other issues are handled. Question 16. A patient is diagnosed with sepsis due to a urinary tract infection, UTI. What is the correct sequencing of codes? A. Sepsis followed by the UTI. B. UTI followed by sepsis. C. Code only sepsis. D. Code only UTI. Answer, A. Sepsis followed by the UTI. This question is about sequencing codes when a patient has sepsis due to a localized infection. The guideline states that when sepsis is documented as being due to a specific infection, the code for the underlying systemic infection, sepsis, is sequenced first, followed by the code for the localized infection, UTI in this case. This is because the sepsis is the more serious, systemic condition the patient is being treated for. For example, if a patient comes to the hospital critically ill with a widespread infection caused by a UTI, the sepsis code is primary. Remember, when sepsis is caused by a localized infection, code sepsis first. Question 17. A patient is diagnosed with a fracture of the tibia. The documentation states the fracture is closed. Which term indicates this in the alphabetic index entry for fracture, tibia? A. Open. B. Closed. C. Stress. D. Pathological. Answer, B. Closed. This question tests using descriptive terms in the alphabetic index. The diagnosis is closed fracture of the tibia. After finding fracture and then tibia in the alphabetic index, you look for terms that describe the fracture type. Closed is the term that indicates the skin is intact over the fracture site. The alphabetic index will list closed as a subterm under fracture, tibia, leading you to the appropriate code series. For example, if an X-ray shows a break in the tibia bone but the skin is not broken, it's a closed fracture. Use the term in the documentation, like closed, to find the right entry in the index. Question 18. A patient has documentation of both acute and chronic sinusitis. If separate codes exist for acute and chronic forms of the same condition, and both are present, how should this be coded? A. Code only the acute condition. B. Code only the chronic condition. C. Code both the acute and chronic conditions. D. Use a combination code if available. Answer, C. Code both the acute and chronic conditions. This question addresses coding when a patient has both acute and chronic forms of the same condition. The general guideline is that if both acute and chronic forms of a condition are present, and ICD-10-CM has separate codes for each, both codes should be assigned. This provides a complete picture of the patient's condition. For example, if a patient with long-standing chronic sinusitis suddenly develops a flare-up with new symptoms, both the chronic and acute codes are appropriate. Remember to code both if the documentation specifies both acute and chronic forms are present, and separate codes exist. Question 19. A patient presents to the emergency department with abdominal pain. After evaluation, the diagnosis is determined to be appendicitis. What is the correct principal diagnosis? A. Abdominal pain. B. Emergency department visit. C. Appendicitis. D. Evaluation of abdominal pain. Answer, C. Appendicitis. This question tests the concept of coding signs and symptoms versus a confirmed diagnosis. The patient initially presented with abdominal pain, which is a symptom. However, after the evaluation, the definitive diagnosis is appendicitis. When a definitive diagnosis has been established and documented by the physician, that definitive diagnosis should be coded instead of the symptom. The abdominal pain is simply a manifestation of the appendicitis. For example, if a patient goes to the ER with chest pain, and after tests, it's diagnosed as a heart attack, the heart attack is coded, not just the chest pain. Always code the confirmed diagnosis when it is known. Question 20. A patient has a history of smoking. This is relevant to their current respiratory condition. What type of code would be used to capture this history? A. Current smoker status. B. History of present illness. C. Personal history of tobacco use. D. Family history of smoking. Answer, C. Personal history of tobacco use. This question asks about coding a patient's past behavior that is relevant to their health status. The term history of smoking indicates that the patient previously smoked but may not currently smoke. ICD-10-CM has specific Z codes to report personal history of certain conditions or risk factors, such as tobacco use. This history is important for risk assessment and treatment planning. For instance, even if someone quit smoking years ago, that history impacts their lung health and is relevant to treating respiratory issues. Use personal history codes for past conditions or behaviors that are medically relevant. Question 21. A patient is seen in the outpatient clinic for management of their type 1 diabetes mellitus. What is the minimum number of codes needed? A. 1. B. 2. C. 3. D. 4. Answer, A. 1. This question asks about coding type 1 diabetes mellitus without complications. Type 1 diabetes mellitus itself has a specific code in ICD-10-CM, E10. Unless the documentation specifies a complication or is also managing another condition, a single code for the type 1 diabetes is sufficient for a routine management encounter. For example, if a patient just comes in to check their blood sugar levels and adjust insulin for their type 1 diabetes, one code for the diabetes is generally needed. Code the condition being managed. If there are no complications documented, one code is usually sufficient for the diabetes itself. Question 22. A patient is diagnosed with essential hypertension and also has benign prostatic hyperplasia, BPH. The physician documents both conditions. How should these be coded? A. Code only essential hypertension. B. Code only benign prostatic hyperplasia. C. Use a combination code for hypertension with BPH. D. Code both essential hypertension and benign prostatic hyperplasia separately. Answer: D. Code both essential hypertension and benign prostatic hyperplasia separately. This question tests coding unrelated conditions. Essential hypertension is a condition affecting blood pressure, and benign prostatic hyperplasia is a condition affecting the prostate gland. These two conditions are generally not considered related unless specifically documented otherwise by the physician. Therefore, you would code each condition separately using their respective ICD-10-CM codes. For example, a patient can have high blood pressure and an enlarged prostate. These are treated as two distinct medical problems requiring separate codes. Code each distinct condition the patient has that is relevant to the encounter, unless a guideline or index entry links them. Question 23. A patient is admitted with a hip fracture sustained in a fall at home. The physician documents the fracture is displaced and located in the neck of the femur. What information is needed to select the correct code? A. Only the fact that it is a hip fracture. B. Only the cause of the fracture, fall. C. The location of the fracture, laterality, left/right, displacement, and the type of encounter. D. Only whether it was open or closed. Answer: C. The location of the fracture, laterality, left/right, displacement, and the type of encounter. This question emphasizes the detail required for coding fractures in ICD-10-CM. To accurately code a fracture, you need specific details provided in the documentation. For a femur neck fracture, you need the precise location, neck of femur, which side, laterality, whether the bone fragments are in their normal position, undisplaced, or moved out of alignment, displaced, and the type of encounter, initial, subsequent, sequela, indicated by the seventh character. Knowing if it was open or closed is also crucial but not the only detail needed. For example, a displaced fracture of the left femur neck requiring initial treatment would have a very specific code reflecting all these details. Precise fracture coding requires capturing location, laterality, displacement/non-displacement, and encounter type. Question 24. A patient presents for follow-up of a healed fracture of the radius that occurred 3 months ago. The fracture is now completely healed, and the patient is not receiving any further treatment for the fracture itself. What seventh character should be used for the radius fracture code? A, B, D, C, G, D, S. Answer: C, G. This question is about using the correct seventh character for fractures that are healed. The documentation states healed fracture and not receiving any further treatment for the fracture itself. While D is for subsequent encounters during healing, and S is for sequela, late effects, The character G is specifically used for subsequent encounters for a healed fracture. This indicates that the fracture is no longer undergoing active treatment or routine healing but is still being followed. For instance, if a patient comes back for a checkup after their broken arm bone has fully mended, the G character shows the fracture is healed but still being monitored. Use G for healed fractures seen in follow-up. Question 25. A patient is diagnosed with acquired absence of left breast due to previous mastectomy. How should this be coded? A. Code mastectomy only. B. Code absence of breast only. C. Use a code for acquired absence of breast, specifying laterality. D. Code the history of breast cancer. Answer, C. Use a code for acquired absence of breast, specifying laterality. This question is about coding the consequence of a past medical procedure. The documentation states acquired absence of left breast due to previous mastectomy. While the mastectomy caused the absence, the current condition is the absence of the breast. ICD-10-CM has specific codes for acquired absence of body parts, including the breast, with laterality. This code captures the physical state of the patient after the surgery. For example, if a patient no longer has their left breast because it was surgically removed, you code the acquired absence of left breast to reflect this current anatomical status. Code the current condition or status resulting from a previous intervention.